We have never been before seen a pandemic sparked by a coronavirus. This is the first pandemic caused by a coronavirus. In the days and weeks ahead, we expect to see the number of cases, the number of deaths, and the number of affected countries climb even higher.
December 31, 2019, the world wakes up to a health scare in Wuhan, China, a port city of 11 million people. Several cases of unusual pneumonia is reported, but the virus is unknown. On January 7, 2020, officials announced they had identified a new virus, and according to the World Health Organization, the novel virus belongs to the coronavirus family, which includes SARS and the common cold. Coronaviruses are common and spread through being in proximity to an infected person and inhaling droplets generated when they cough or sneeze or touch a surface where these droplets land, and then touching one's face or nose. As at February 24, 2020, the death toll in China rises to over 3,000 among 77,262 confirmed cases, while the country takes precautionary measures to stop the spread, shutting down schools and businesses and sensitizing the public against gatherings. From China, coronavirus, renamed by WHO as COVID-19, spreads its tentacles to other parts of the globe, ravaging many developed nations including the UK, Italy, Germany, Spain, Canada, the entire 50 states of the US. A number of African nations, including Nigeria, have recorded cases and are now shutting their borders to prevent more index cases. At the terminal of the Murtala Mohammed International Airport, passengers arrive in their numbers.
So we're just transiting, so it was just pretty much filling the form, and hand sanitizer usage and all of that were not really heavy, yeah. So it is good to see what we're actually experiencing here.
When I went to Nairobi, there didn't seem to be much awareness in Nairobi, and the screening process wasn't like here in Nigeria, and we did talk about it. Also, when I got to Tanzania, it was a bit lax. There was just a few people in line waiting for the passengers to come, and then they ask you to fill out forms, and that was it, and they spray hand sanitizer on your hands and then let you go.
It's right to commend that the health staff on ground. It's also right to commend that they have all of the right equipment for which they can use to test. Part of the observation is for us to encourage them to ensure that the forms are filled properly and they are filled legibly and there are no missing information whatsoever. But it's also appropriate to commend the commitment of the staff that we have. The medical director said to us privately too that a few concerns and a few requests which we'll be willing to support them with will come directly to me, and one or two other observations that we feel can enhance the total level of preparedness. We will also pass it on to them.
In Nigeria, after the confirmation of the index case of an Italian businessman, officials tightened measures to contain the spread of the virus. But as at 18th of March 2020, 5 more confirmed cases is announced.
Port health services will be strengthened at these airports. Other airports shall be closed to international traffic, but not to domestic traffic. These decisions will be reviewed as the situation demands. Travelers from all countries shall be required to self-isolate for 14 days after entry, following the guidelines provided to them. Non-compliance puts your family, your friends, and the public at risk, even if you feel very well. As for arrivals from high-risk countries named, their self-isolation shall be supervised in the form of follow-up to be conducted by Port Health Services and NCDC with the option of doing a testing as need arises. According to our national case definition, we have identified 2 more high-risk countries, Austria and Sweden, who were added in the past 24 hours to the list. We are also including COVID-19 testing in our routine surveillance for influenza-like illnesses.
The news saddens Nigerians.
If you look at China now, it started from there. But over the last 1 week now, there's not been any new cases. Means they've somehow been able to curb it properly, take those that have been infected, isolated them well, sanitize the entire place properly. They need to be like, I'm coming from court now, and there are no sanitizers in court. They need to be in public places, police stations, hospitals like that.
The truth is that our government should be completely sincere. They should not allow anybody in and out of Nigeria.
The federal government announces travel restriction on nationals from high-risk countries into Nigeria.
All persons arriving in Nigeria who might have visited these countries 15 days prior to such arrival will be subjected to supervised self-isolation and testing for 14 days. The federal government is Number 3, the federal government is temporarily suspending the issuance of all visas on arrival. Number 4, the federal government is also counseling all Nigerians to cancel or postpone all non-essential travels to these countries. And number 5, the federal government urges public health authorities of countries with high burden to conduct diligent departure screening of passengers and also endorses travel advisories to their nationals to postpone travels to Nigeria. And fourthly, these restrictions will come into effect from Saturday, 21st of March 2020, and it will last for the following 4 weeks, subject to review as the situation unfolds.
The National Youth Service Corps NYSC management orders the closure of orientation camps across the 36 states of the Federation, including the FCT Abuja, to curb the spread of coronavirus. The directive disrupts the 3-week orientation camp of the 2020 Batch A Stream 1. They are sent to their various places of primary assignments.
With the problem that is being experienced worldwide, the COVID-19 virus, we decided, or the federal government, under the auspices of the National Youth Service Corps, decided to cut the orientation exercise short as a way of proactive measure to stay safe. I need to say that there's no record of any experience of the virus in any NYSC orientation camp, not even in Lagos here. But I think the wisdom in closing the orientation camp halfway is to ensure that human beings in the orientation camp is guarded against it. And again, knowing that the present international practices to avoid the contact of the virus is to stay away from people, and more so to have less of crowd, in a particular place. And you can also see that I already have a number 2,000 plus. I think all this is part of the reason why the federal government decided to take the decision. In Lagos here, we have been able, we were instructed to organize their posting letters.
So we are hoping that this virus is contained well in this country, that the proper ministry, the Ministry of Health, should do something positive so that the virus will be exterminated.
Northwest governors arrive for an emergency meeting. And the issue is simple. They must find a way out of the quagmire of COVID-19.
We are working with the examination bodies who are going to close all schools and discourage any public gathering, whether it is ceremonies and all over. We are going to do that to discourage.
Other states follow suit, closing schools, advising only minimal number of gatherings in worship centers and other places.
Having discussed extensively on the issue at hand, the hierarchy of the religious bodies have agreed on the following. We hereby agreed that we suspend all large religious congregational gathering of over 50 people in both the mosque and churches and any other location within the state for the period of 4 weeks. That a committee should also be set up comprising religious leaders that will monitor the situation and review decisions on a daily basis during this period. We also advise that preventive measure of hand washing with water and soap, and also to desist from shaking hands and getting closer to each other. Government should embark on massive sensitization and education of the people at the grassroots, using the local government and local council development area officials.
All secondary schools in this state will close by 27th of March. And when to resume would be as when directed by government. This is to say that those who have exams ongoing or have not started will start and complete by Friday or next week, so that everybody will be at home. With regards to tertiary institutions, I have spoken to some rectors and provosts of colleges. Some have just resumed, and the students may go ahead and do registration. But by next week, 27th of March, all the schools in Benue, whether they are secondary, whether they are tertiary, they will all be closed.
The ban of over 50 people in a gathering is a welcome development for some religious leaders.
Take all the necessary precaution, because the virus, COVID-19, is real. It's not false evidences appearing real, like people coughing. No, this is real. It's killing people. Thousands in Italy, all over the world, in America. China have been able to control it because of the measures. So we must take every measure. But we must not succumb to fear and despair and hopelessness. So this is the time the strength in us is being tested. Our system, everything. Church is an expression of the kingdom of God on earth that must recognize, respect, and be subject to civil authority. It's in Romans chapter 13. Whether any man of God, anointed woman of God, or church system or religious system that is anti-civil authority, it's not divine. Because the Bible says there is no power, no government can be except God allow it.
To cushion the effect of COVID-19 on citizens, government announces some measures which include a credit relief of $136.6 million to businesses affected by coronavirus pandemic. The governor of the Central Bank of Nigeria, Godwin Emefiele, says households, small and medium-sized enterprises, airline service providers, hotels, healthcare merchants will benefit from the funds.
We are here to provide you with our understanding of the preliminary effects of the outbreak of the coronavirus, which began in Wuhan, China, in December 2019. And second, and more importantly, we are here to announce our first set of response which reflect our understanding of the effects of the virus on our people. You probably already know that thousands of people, hundreds of thousands of people are affected by this pandemic, and indeed thousands of people have died. And in different parts of the world, leaders in those countries, Fed chairs or the governors of central banks in those countries have all started to respond as to what actions would they be taking to mitigate the pains that will be visited on their people as a result of the outbreak of this coronavirus pandemic.
Other interventions by the Apex Bank include the reduction of interest rates for loans from 9% to 5% retroactively to March 1st. 100 billion naira loan support for health laboratories in the country, and an increased intervention in the manufacturing sector by 1 trillion naira.
Given the growing global risks that we are ramping up our response, especially given the dire state of our oil revenues, the dire state of the global crude market, which for some of you who may have been monitoring developments in the crude oil market will agree that as of today, crude price attained unfortunately a level of $25 per barrel. First, the CBN is directing all deposit money banks to increase their support to the pharmaceutical and healthcare industries, because given the unfortunate increase in the number of people who are returning back home, either on holiday or who for one reason or the other need to be with their families, most of the cases that have been established in Nigeria are cases of people who are returning home. And we must all agree that as Nigerians who are living abroad, they truly do deserve to be back home to their families, given the uncertain, unfortunate circumstances that currently beset the world. Our banks should please open their doors and grant facilities to hospitals, healthcare facilities, healthcare centers, for them to procure needed materials for them to be able to take on this unfortunate health crisis in the country.
Officials say they are putting further measures in place to ensure that the virus is checked in the country, as 1 billion naira has been set aside for the control and management of the epidemic. The World Bank and IFC's boards of directors also approved a $14 billion package of fast-track financing to assist companies and countries in an effort to prevent, detect, and respond to the rapid spread of COVID-19. The package is aimed at strengthening national systems for public health preparedness, including for disease containment, diagnosis, and treatment, and supports the private sector. IFC, a member of the World Bank Group, will increase its COVID-19 related financing availability to $8 billion as part of the $14 billion package, up from an earlier $6 billion, to support private companies and their employees hurt by the economic downturn caused by the spread of COVID-19. As the virus takes its toll on nations, the head of the World Health Organization, Tedros Ghebreyesus, calls on Africa to wake up to the threat. There was no reason for complacency.
All countries must strike a fine balance between protecting health, minimizing economic and social disruption, and respecting human rights. I remind all countries that we're calling on you to activate and scale up your emergency response mechanisms. Communicate with your people about the risks and how they can protect themselves. This is everybody's business. In the days and weeks ahead, we expect to see the number of cases, the number of deaths, and the number of affected countries climb even higher. WHO has been assessing this outbreak around the clock, and we're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction.
At its daily briefing, where it gives updates about situation reports, the Commissioner for Health in Lagos emphasizes social distancing to curb the spread of the virus in the state.
There are several stages of social distancing, and you need to look out on our social media handles and the material that we're going to be circulating both in the press, on video format, and on our social media to understand the principles of social distancing. But effectively, it means no touching. It means if you're unwell, stay at home, particularly if you have respiratory symptoms. Communicate with your medical professionals and personnel. If you are worried, you contact any of our hotlines, and the best line to use is 08000 Corona. I repeat, 08000 Corona.
Once banned chloroquine will now return to shelves as NAFDAC approves the production of the medicine for clinical trial in tackling COVID-19.
Chloroquine, just like hand sanitizers, have been proven through experience and through the way the virus works, that washing of hands or using hand sanitizer will kill the virus. And in terms of, in the case of chloroquine, it has been demonstrated in literature and done with clinical research or trial that is still ongoing, that chloroquine is superior to the placebo. I have to quote what is written. NAFDAC is not approving chloroquine as a product that can be used for coronavirus because there is no submission to us for registration. But because it's under clinical trials, NAFDAC approves medicines meant for clinical trials. Because without medicine, you cannot do clinical trial. For COVID-19, it is a viral infection. If the doctor approves that it should be used, it's supposed to be limited, and nobody has infection every day. So it should be limited to that use, whereas for anti-malaria, it occurs every maybe 6 months, every 4 months from some people, in which case anti-malaria can be used repeatedly, but anybody should not use chloroquine as anti-malaria, in which case after the COVID-19 crisis has passed, nobody should use chloroquine as anti-malaria.